So thank you everyone for coming today. My name is Joan King and I work in the Career Services Center here at Santa Monica College, and we have an exciting workshop, a guest speaker here today. But before I continue on, I just wanted to kind of go over some logistical stuff. And just the basic stuff is that if you are here for any verification purposes outside of a PHA sign-in purpose or verification, please make sure to stay on for the event and you'll get some more information in the chat towards the end of the workshop. And then if you ever need some career assistance, whether it's resume writing, gaining some experience, please reach out to the Career Services Center and book an appointment with us. You might be meeting with me as your career advisor that works with all students who want to kind of go into the health area. But I wanted to introduce our co-host, because this event is co-hosted by not just Career Services, but our student club, the Pre-Health Association. So please let me introduce your president, Julie Lam, who will be serving as a moderator of this event.
Thank you, Joan. Yes, hi everyone. My name is Julie Lam and I'm the president of SMC's PHA, Pre-Health Association. I hope all of you are joining our club. Every week we host workshops and different speakers just like this one. So make sure you don't miss out and sign up. Before we go on, I have just a few quick announcements. Let me share my screen. And let me know if you see my screen. Thumbs up. Good, cool. So just a couple quick announcements. We probably introduced this last time. Our advisor is Dr. Colin Ellis. I'm President Tuli. Lily's our vice president. Melissa is our ICC delegate. Natasha is our public relations representative. Zara, our outreach coordinator. Kate, our secretary, and Nicolette, our treasurer. And just a couple quick reminders during this meeting. Please use your first and last name for attendance purposes and always keep yourself muted. For attendance purposes, if you are looking to get credit for a PHA meeting, we will be sending out a link for attendance about like 3/4 away through this meeting. So look in the chat for that link. And if you have a question, please type it in the chat or raise your hand and I'll be moderating. So I could either read your question or I could call on you if you decide to ask your question yourself. So without further ado, here, I'd like to introduce Tony Espinoza Farrell. Tony is a lecturer at CSULB's Health Sciences Department, teaching in areas of community health, human sexuality, health education, and having been both a graduate program coordinator and graduate program director for a consecutive 20 years at CSULB. She's won the 2021 CSULB Distinguished Faculty Advising and Mentorship Award. And with over 30 years of experience in the evaluation of public health projects involving youth, sexual issues, sexual health issues, tobacco, drugs, and alcohol issues. She has, her expertise ranges all aspects of data from its collection, management, to its analysis. And she is here with us today to tell us about public health programs at CSULB and to give us insight into exploring the various careers in public health. So welcome, Tony.
Thank you for that introduction. Okay, do you mind stop sharing your?
Yeah,
perfect. Excellent. I'm going to share my screen. Okay. Let's see. Can everyone see my PowerPoint okay? Perfect. So thank you. I am Tony Espinoza Farrell. I have been teaching for many years, since 1997, which is probably way before many of you were even born. I currently teach drugs and health, orientation to health science, evaluation and measurement, and I really have a fun class that I teach that's called Independent Study, where I'm able to work closely with students on various research projects. I love working with students. So thank you for having me. Today, I'm going to talk to you a little bit about public health. When students come to our health science department, most of the time they are either planning to go on to a nursing degree, a PA degree, maybe even physical therapy. Not too many come in really wanting to be public health educators. And a lot of that, I think, has to do with people not really hearing about public health education and what kind of positions are available. So that's why I'm here today, to talk to you a little bit about that. So what is public health? Public health addresses the systematic factors that impact an individual's health that leads to improvement in health for peoples and communities all over the world. This is, in a nutshell, what we do. We like to work with preventing diseases before they even happen. I think this is a really important diagram to share with you, and it's related to the social determinants of health. So the social determinants of health has a major impact on everyone's health outcomes. And when you look at the social determinants, approximately 80% have everything to do with socioeconomic factors, the physical environment, health behaviors, and only 20% are related to healthcare and access to healthcare. So what does that mean? It means that 50% of your health is related and can be traced back to where you live. So for example, in terms of education, job status, family social support, income, community safety, these are very important factors. In fact, 40% of what make up your health. Then there's the physical environment, and we'll go into more detail in the next slide. And then your health behaviors, whether you are a tobacco user, if you exercise, what do you eat, your alcohol consumption, and sexual activity. So let me move on to my next slide. So the social determinants of health, when you look at economic stability, that's referring to employment, your income, expenses, what kind of debt you have, medical bills, support. Then your neighborhood and physical environment include housing, transportation, safety, parks. Are there playgrounds? Are there areas in your area that you feel safe to walk in? Then education. This is related to literacy, language, having access to early childhood education, vocational training, and the access to higher education. Then there's food. So food insecurity is a big issue that can determine your health. So that has to do with hunger and access to healthy options. And again, this goes right back to this in your neighborhood. If you don't have transportation or access to grocery stores with fresh fruits and vegetables, and maybe what you do have access to because of lack of transportation are mom and pop type of stores that maybe have higher fat meats or less variety in fruits and vegetables, that's going to impact your health. And then the community and social context in terms of social integration, support systems, community engagement, and any discrimination. And then there's the healthcare system, which includes healthcare coverage, provider availability, even provider bias, cultural and linguistic competency, and the quality of healthcare that you receive. All of these items relate to your health outcomes that will affect your mortality, your morbidity in terms of, diseases and sickness that you may have, your life expectancy, healthcare expenditures, your health status, and any functional limitations. So really, as a public health educator, these are the factors that we look at to try to create equity in these areas so that we can improve the quality of health for folks in our communities. So some potential careers. So there's so much more than just nursing and PAing and PT. There are many public health careers that you can either achieve with a bachelor's degree in health science, or sometimes there's additional certificates or licenses that you may need, or a master's in public health, which all of these things are available at Cal State Long Beach. So you can work as a health educator. This could be in one of our government health departments. Where we are located is super cool because not only do we have the LA County Department of Health and Human Services, but we have Long Beach, we have Orange County, which isn't too far. And then in LA, there's another, Pasadena is another place where you can be hired as a health educator. You can work in community-based organizations. There are many, including KYCC, the one I'm going to talk about today, that offers positions for public health educators. You can work as a middle or high school teacher. You will need a single subject school health credential, which we have in our department as well, but you can teach middle or high school with these degrees. Environmental health specialist. I have many students that I have mentored over the years who are now working as environmental health specialists. You could be a community health planner, epidemiologist, biostatistician. With those two, typically you do need a master's degree, but as a biostatistician, actually that's my first job, actually my second job out of undergrad, but I was a master's of public health student. I worked as a biostatistician for Long Beach Memorial Medical Center. You can be a public policy maker, health informatics specialist, which I'm so excited about this one. We are starting a new program that will probably begin in 2023 in our department. And this is a growing field. In this area, that's where you have your data scientists, and you will be trained to be able to work in healthcare settings and work with helping them with their data. It's really exciting stuff and new. You can work as a healthcare administrator, a communicator. You can help prepare. Most of our local health departments have departments where they are specifically working towards emergency preparedness. They've been very busy over the past 2 years with COVID, and that's something that you do. You try to foresee any kind of public health issues, and you have a plan to help educate the community to, again, keep the community safe. You can be a public health researcher, a health policy administrator, which we have a great internship at the state of California in Sacramento for health policy, if that's something you're interested in, and a health behavior specialist. So have you all thought about what you're going to do after you graduate? Have you considered a career in public health? Anyone want to share with hands raised? I'm actually interested to know how many people think about public health and only think of PA, PT, nursing.
Oh, is PT considered part of public health?
So it is an allied health field, but it's not necessarily what I would consider public health. It's more of the things that I just described. But a lot of times people, when they think they want to go into public health, that's what comes to mind is the nursing, PA, and PT. So I was just sort of curious, were all of you interested in a career in public health in terms of what I've been sharing?
Yeah, show of hands, whoever's interested in public health. We got somebody.
Great.
Get a few people.
Excellent.
There you go. Yay.
Here we come. So hopefully after my talk today, more of you will be interested specifically in some of the positions that I mentioned. Okay, so when our students are asked by family or friends, what is health science? What is public health? I typically will go through some of these items and I will give them examples that they can share with others. So you think about, what you eat, how much you exercise. These are all important factors in being healthy. And sometimes this could be just related to your good genes. But in public health, we're trying to improve the conditions that are around you to not only promote healthy behaviors, but make your environment healthier. So let's talk about some of these things. In terms of cancers, approximately 80 to 90% of all cancers can be caused by environmental and lifestyle triggers, as opposed to genetics. So environmental health specialists will work hard to keep us safe. They work in our restaurants and they do inspections. And I will tell you, I have a guest speaker who comes into one of my classes who is an inspector, and you only want to eat at restaurants with A's. That's all I have to say about that. Okay. According to the Department of Health and Human Services, secondhand smoke causes approximately 3,000 lung cancer deaths annually. As of 1995, California became the first state to ban smoking in almost every workplace. Can you imagine that? Back in the day, a professor could light up right in front of you and blow their smoke in your face. How horrible is that? So that has been eliminated. That is no longer something that anybody can do, or even just your colleague in the workplace. You're working in cubicles, someone could just light up and you'd have to breathe their smoke. So this is something that public health has worked hard, and actually there are some state-funded grants, which the project that I'm going to talk about at the end of our presentation today is a California state-funded tobacco project, which my first job in 1990 was part of this initiative. But over the last 30 years, they have worked really hard to try to reduce the amount of secondhand smoke that people are exposed to. And one of my first jobs, we had to work with bars, letting first all restaurants went smoke-free, and then bars were the second tier. And I actually worked for a bar when I was in college, and my boss was like, there's no way you can eliminate smoking in a bar. All bars will close. Have bars closed? No. So again, these are efforts provided by the state of California working on keeping us healthy by reducing our exposure to secondhand smoke. The true danger of an innocent donut became much more apparent thanks to public health. So trans fats are a major contributor to coronary heart disease. And as of 2018, artificial trans fats have been banned by the FDA at restaurants. This is another one. You probably don't remember this because you've probably always have been clicking yourself in with your seatbelt, but wasn't that long ago that this was something that it was, optional. And so public health officials and the public health workforce have worked to create this policy. So it is a policy that was created to help keep people safe by making sure they use safety belts. And in that process, we have saved many lives. Now, this is probably where I would say more people know a little bit more about public health, and it's because of COVID. So public health efforts that have helped to reduce the spread of COVID include education, educating folks on washing their hands, wearing a mask, becoming vaccinated, and helping folks feel comfortable, those who are hesitant to get a vaccine. In terms of other positions that are available, if people were interested in working with COVID, you can be a statistician and work with statistics, epidemiology, program management, computer-related positions. You can be a community health worker or management of clinical trials and research programs. The flu. This is also a public health issue. In the US, influenza causes an annual average of 36,000 deaths, ranking it 7th among all causes of death. I just read that COVID is ranked 3rd right now, below it's heart disease, cancer, then COVID. So hand washing and vaccines are encouraged by public health workers. The percentage of overweight children has soared to epidemic proportions in the last 20 years, with approximately 18% of children affected. Programs have been developed to increase and encourage healthy behaviors to reduce childhood obesity. Mosquitoes. So when it's mosquito season, you start hearing about different diseases that are associated with it, including West Nile. This is an inflammation of the brain caused by the virus that is transmitted through mosquitoes. So we have vector control that collects mosquitoes, tests them to make sure that we are not letting water sit so that the mosquitoes can continue to breed. They will educate the public on not having standing water around your home, again, to prevent the breeding of mosquitoes. So I have a little fun quiz that I'm going to do with you. And is it okay if everybody unmutes their, or maybe raise hands? I'm not sure how you want to do this.
Sure, I can just call, and if you want, I can just call in whoever.
Okay, perfect.
Yeah.
And then we have, I'm going to, after everyone has a chance to answer a question, or for the, I think I have 10 questions, I will do a drawing for a coffee card at the end of our presentation. So you ready? Here we go. What is the leading cause of death in the US?
Okay, I guess we're not doing hands. People are just sending texts.
Okay, so do we do
But
the
most
first
people
one?
think it's the first one. Yeah.
Correct. It is heart disease. So should we do the first person who chatted maybe?
Yes, that's Edmund Sarion.
Okay, Edmund. Excellent. You are correct. It is heart disease. What is the process of sterilizing milk called? Do we have an answer?
Yes.
Was
It's
it pasteurization?
Pasteurization. Yes. Correct.
Excellent.
And the first person was Natasha.
Good job, Natasha. Next. Which disease has been completely eradicated? Anybody know? If you said
It's A,
smallpox. Correct.
And the first person was Arash Kangoli, I guess. Arash Kangoli.
Excellent. Which will not protect against foodborne illness, for example, food poisoning? Which one of these will not protect you?
I think we agree it's organic.
Very good. First
And
person?
Christine Nagayan. I'm butchering the name probably, sorry.
All right, next question. Which of the following toxic elements causes the neurological disorder that inspired the Alice in Wonderland character, the Mad Hatter? You answered mercury, you're correct.
All right, the first person was Tara.
Tara, good job, Tara.
Tara Sohi.
Next question. Which disease is not correctly paired with the nutrient or a vitamin that prevents it? If you said TB or tuberculosis, you are correct. Niacin does not protect you against tuberculosis.
And it was Jessica.
Jessica, good job, Jessica. All right, next one. Epidemiology is the study of if you said outbreak of disease in populations, you are correct.
Great. And first person said that was Leo.
Leo?
Yeah.
Perfect. Folic acid, which is found in oranges, prevents which of the following? If you said birth defects, you are correct.
Oh, well, that would be Tara.
Tara, good job.
Sohi, Tara Sohi.
Okay. Ooh, Tara, you have an extra chance to win. Which of the following is considered a milestone in dental public health? Fluoridation of drinking water, introduction of mouthwash, development of the electric toothbrush, I think that helps, and use of gold amalgams. If you said fluoridation of drinking water, you are correct.
This one was hard to tell because from before. I'll have to say it was really fast, so I'm not sure. So I'm gonna hold off on this one.
It was Lily E.
Was it
Lily
Lily E? Okay,
Yeah.
Lily E. Because the
Lily
answer
E.
before was also A, so it was like, okay, perfect.
Okay, great. Of the 48 million Americans that currently smoke, how many will die from a smoking-related disease if they continue to smoke? This one may surprise you. 50%. Did anybody choose 50%?
Yes, Natasha.
Natasha, good job, Natasha. Next question. How much exercise is recommended for the average adult? "20 minutes of intensity at least 3 times a week." Do we have a winner?
Yes, we do. It is Christine.
Christine, good job. What is a communicable disease? If you said a disease that can be spread from one person to another, you are correct.
It's Lily E.
Good job. Okay, at the end of our presentation, we will choose a winner. Okay, so health science, CSULB Health Science Department has approximately 1,000 undergrads and about 70 MPH students or graduate students. In terms of the options that we have for undergrad concentrations, we have community health, school health. We just added some certificates. So we now have a Latino health certificate, global health, and we are adding information and informatics in health. I'm trying to think of the actual title. It's basically public health informatics. That is something that is going to be started soon. And that's a heavily concentration in data science related to public health. In terms of our master's degree, we do have a master's in public health that makes you very marketable for public health positions. We also have some centers. We have a Center for Latino Community Health Evaluation and Leadership Training, where we offer many internship opportunities, many paid, and many that may pay for your tuition as well. We have a Center for Health Equity and Research, and we have a very active HSSA, or Health Science Student Association. So what public health initiative is currently happening on your campus at SMC? KYCC has a project called Project Break Free, and my next guest that is an intern for Project Break Free and a current student at Santa Monica College is Audrey, and I'm going to go ahead and let Audrey begin.
Thank you, Tony, and SMC Career Service Center. And hello, everyone. I'm Audrey, and I'm a year 2 student at SMC. I'm also a prevention specialist intern at IofDC, which stands for Los Angeles Youth First Tobacco Coalition. In this presentation, I would first like to talk about our Project Break Free team. And just to clarify, IofDC is the coalition of Project Break Free. And then I will share the information on IofDC missions, visions, and who we are. After that, I will discuss the 2 committees that we have and my internship experience. And lastly, I will share some resources that IofDC provides to everyone. So Project Break Free is a community service-based project focused on assisting community college to go 100% smoke-free, including enforcement of the policy once they are adopted. Our mission is to promote community engagement and mobilization to reduce exposure to secondhand smoke on campus. Some activities that we have been working on are partner with IofDC to connect with youth on tobacco-related topics, provide free educational training on advocacy and tobacco-related topics. We were also outreach at booths and virtual events to share educational materials and sensation resources. One of the reasons we create this project is that we recognize how serious the impact can be on the student. For example, secondhand smoke contains 7,000 chemicals, and as shown in the infographic, it could lead to lung infection, lung cancer, asthma, low birth weight, heart disease, and premature aging on our skin. We won't go deep today, but just to give an idea of the negative, but just to give some ideas of negative effect of secondhand smoke to everyone, we will definitely talk more about this topic in the future. There are so many benefits of a smoke-free campus, such as decreasing exposure to secondhand smoke, changing tobacco use behaviors, decreasing tobacco litter on campus. Even though SMC has passed the smoke-free campus policies for more than 20 years ago, they still haven't implemented policies. There are still smoking areas on campus, such as near the parking structure 4, air complex building, math and science building. Currently, our project breakthrough team is still working on assisting SMC to adopt the policies by reaching out different SMC professors and clubs to help them to understand the issues. And hopefully SMC will implement the policies in the near future and give a healthier environment to the students. Okay, next slide. So let's get back to IofDC. Who we are. We are comprised of staff, college students, high school students, and other organizations who share the same interest in tobacco prevention and control. And we are also a group of people who are working on making our community a better place to live. IofDC's vision is to create a healthier and safer community by reducing the youth access to tobacco products. And our mission is to empower and mobilize communities to reduce tobacco-related death and disease throughout LA area. So the two committees that we have, each of them have different responsibilities and functions. They are Project Development Committee and Media and Communications Committee. Okay, so the Project Development Committee, we are mainly working on brainstorming and selecting projects to work on, such as research projects and presentations. We are also seeking opportunities to collaborate and intersect with other committees. Moreover, we are doing research to provide suggestions of potential projects that the coalition could be working on in the future. Projects that we have worked on, like the hazard of tobacco product waste presentation. The next committee that we have is Media and Communications Committee. We are using design tools like Canva to create social media content and maintain our social media community engaged and active. We are also creating flyers and leaflets by planning, researching, and developing. Furthermore, we are offering brainstorming new ideas to improve the promoting strategies on social media platforms. Projects that we have worked on are like art contents, flyer, and social media content. During college time, I believe some of us have been struggling to find the right career for us, and I am one of them. Even though I decided to major in statistics, I'm still switching different careers in my head over time. But one thing that I'm sure about myself is that I want to make a positive impact on my surroundings. When I first found out about IofDC, I decided to apply the internship program because my relative died from smoking. She had cancer, and even though she had her surgery, she still left me and my family. So I really hope to put effort into helping keep everyone free from tobacco-related harm. During the internship, I did not specifically belong to project development committee or media and communications committee. I have been working on different projects from designing flyers to conducting public health related research and outreaching to SMC clubs and professors. I have learned how to design flyers, how to research and conduct real presentation in the workplace, how to expand collaboration from different clubs and professors. What I enjoy the most of being part of IofDC is that it has been opening to me for different options. I get the chance to pick the projects that I would love to work on. Moreover, it will also often give different opportunities to intern, to visit different virtual and in-person events, such as the tabling event at Farmers Market, virtual designing events, volunteering opportunities. I have got so many chances to meet a lot of amazing people, explore my interests, and also make contributions to the community. All right, next slide. For anyone who would love to join our coalition and make an impact on your community, we have an internship opportunity right now. The benefits of being our intern are earning a stipend of up to $550, earning recommendation letters, gaining public health research or design experience. What you will learn in this internship include advocacy, leadership, data collection, public speaking, and more. We are welcoming all major students, especially those who major in public health and social service. And here is the link to apply. And I will put it in the chat box. I will also drop the flyer in the chat later on in case anyone needs it. So for anyone who needs assistance in quitting the use of tobacco products or having any questions on tobacco related topic, we are here to help. Please contact us through the information in the link tree. The link tree is in the link side, yes. And that's it for my presentation, and I hope everyone enjoyed it and find it useful.
Wow, that was a very, very amazing presentation, Audrey. Thank you for sharing.
Thank you.
How many of you guys are interested in this cool internship? You get paid and so many benefits. She's put in the form on the chat, so you guys should apply as soon as possible. And also, in addition to that, our PHA attendance form has gone out, so make sure you sign that if you need credit for this meeting. And finally, I would like to, oh, yes, Diana, do you have a question?
No, sorry, that was still raised hand from the previous question about being interested in the program.
No problem. Before we go into more questions, I'd like to reintroduce Joan King from the Career Center, because she has somebody else she'd like you to meet.
It's just amazing and I just want to give a round of applause to our student leaders today, Tole and Natasha, and then Audrey as well, and her internship. To see what you guys have been doing is amazing. And I know many of you guys out there in the audience are trying to figure out how else to gain some leadership experience. And so I wanted to make sure that I reintroduce myself. If you need any help with trying to figure out how to gain experience in the careers that you want to go into, please reach out to me. I will put my information in the chat. I also want to just introduce my colleague, and Jenny, and Jenny will come on and tell you a little bit more about what she does.
Hi, everybody. I'm Jenny. Actually, you can call me Jennifer. I find that might be a little easier to remember. And since we also have a counselor named Jenna, maybe it's easier just to remember Jenny. So I'm a career counselor in the Career Services Center. And I do help students in all majors, but I am also the counselor who's dedicated to health and wellness majors, an area of interest. So what I can do is I can help with choosing a major, exploring careers, and just learning about yourself so you can make a well-informed career choice that will be a good fit for you. So as a career counselor, I like to say that I can help you answer 3 questions. Who am I? Where am I going? And how do I get there? So I'm available for appointments. I'm on campus in person on Mondays, And also I can take Zoom or telephone appointments on Mondays as well. And then I also work on Tuesdays remotely. So those are Zoom and telephone appointments on Tuesdays. And I'm not terribly busy right now. So I even have appointments available this afternoon if anybody wants to call in and make an appointment. So to schedule an appointment, just call 310-434-4337. That's the Career Services Center. Or you can email careerservices@smc.edu and make sure you provide your information like your student ID, your availability, and that you're looking to book an appointment with Jennifer. All right, so thank you for giving me a moment to introduce myself.
Thank you so much, Jenny and Joan. Right now, we would like to take any questions. You guys have them for either Joan, Jenny, Audrey, or Tony at all. Please raise your hand or type it in the chat and let's shoot those questions over. I don't see a question yet in the chat, but actually I have a question for you, Tony. I was wondering, so like in terms of like planning for parks, like allocating like playground space or like building skate parks, is that considered public health or like a different thing?
That would probably be recreation and leisure. That is another major option that we have. It's a department in our College of Health and Human Services that's part of Cal State Long Beach. So different, a little different, but we're all housed in the same college. So similar, but a different major.
I see. Also, so what about programs like youth programs, like after school programs? Is that considered public health in terms of like promoting youth, like healthy activities and so on?
So it would depend. Yes. So we have our Center for Latino Health and Evaluation, and they have a few initiatives and grants that they were funded for through the USDA, where they have a nutrition/activity grant where they've created different programming for youth to encourage them to move more and then have healthier choices in terms of, instead of grabbing that bag of chips, maybe have an apple and that kind of thing. So yes, that would definitely be something public health related.
Cool. This is all very interesting. It's my first time like learning all about this.
Good.
Anybody else have any questions?
Well, I do have a question.
Go ahead. Who is this?
This is Jenny, the counselor.
Oh, Jenny.
So I do have a question. I did come in a little late. There was a lot of confusion. Sorry about that. I was not able to hear your presentation from the beginning. So if this is redundant, I apologize. But I know that you were talking about not everybody is going to be a PA or a PT or a nurse. But did you say anything about choosing public health as an undergraduate major for people who do want to go on and do those things, like the benefits of doing that over like a biological science?
You know what? That is such a good point, and I did not talk about that. So many times people will choose health science as their route to going into either nursing or PA or even medical school. I will tell you, just from what I know over the last 30 years, your GPA will be higher than doing all biology, doing chemistry, doing biochem. And that's sometimes where we get some of our students that were beat up by the sciences, but it's very difficult to have that 4.0 GPA that you need to get into nursing school. And with health science, it's not as difficult because you don't have a lot of those science requirements. Now, to get into nursing school, you will need the anatomy and chemistry and physiology and all of those classes, but you can take those at a community college and maybe take one at a time. So it's not that your entire 12 or 18 units are all science-based courses. You have, and honestly, I will tell you, having a public health background with science and becoming a PA or nurse or doctor with that lens of public health and understanding the connection of prevention and how important it is, and understanding people's behaviors, how to encourage someone to make that change with baby steps and not looking at them and saying, you need to lose 20 pounds. No, there's so much more to it. And so having that public health lens, I think, makes you a better practitioner. So super good question. And that really is something that a lot of folks do. They achieve their degree in health science and then go on to some of these other programs. We've had many of our students who currently are nurse practitioners. In fact, one of them, I'm kind of excited because she's doing it in dermatology. So I have to hit her up. But she has a master's degree. And so you can go on to, there are nursing programs that allow folks, UCLA has one also, where you have your bachelor's degree in health science and then can go into a nursing program without that BSN.
Mhm. Yes, thank you. That makes good sense. Thanks. That helps.
Good point. I need to add that to my presentation.
Very interesting question. No one else has a question, but I actually have a question for Audrey. Your presentation was very interesting. I enjoyed it, but there's one thing you brought up that was interesting to me. I was wondering, the smoke zones at SMC, like, why does it take, like, what does it take to get rid of them? And why hasn't the school implemented more stricter rules about that, given the health concerns?
Actually, we have reached out to the health association at SMC and also the nursing club, but they didn't respond to us. So what we can do is reach out to professors and students to see if they can sign a petition, to speak up. That's what we can do.
I see. Because I was wondering why, if from public health, policies are, I guess, made, why that wasn't addressed, maybe in previous elections or something like that. I don't know anything about how the policy gets put in place at SMC, but it was just interesting to me.
I can probably talk a little bit about that. So the way these policies are passed are through the Senate, and the way to get this accomplished is through student voices. If students are saying this is what we want, the Senate and people who make the decisions will listen to you. So right now, all of Cal States have a policy where there is 100% no smoking. And it was sort of something that happened over a few years, but it was from students' voices that went to the chancellor's office and said, we do not want smoking on our campuses. And then a blanket policy was put in place, and each campus slowly became 100% smoke-free. At this time, not all community colleges have that blanket policy. So student voices are important. And if this is something that interests you, get involved with the internship, because they will help you develop the skills and the knowledge on how you can get this done at your campus.
Cool. Thank you so much. Well, if there's no more further questions, I'd like us to give a hand to our special guest, Tony.
We have our drawing.
Oh, a drawing. Don't leave yet. Right. So let's do that first.
Okay, here we go. Here we go. All right. I'm going to do two. So I picked two $10 Starbucks cards. So in the chat, if I call your name, please give me your email address and I will send you a Starbucks card. Natasha is the first one.
Woo! Is that our very own Natasha? That is.
Yay! Okay, next one is Edmund. Edmund S. Ooh, so where's that?
Edmund.
Yay! Excellent.
Congratulations, everyone. So now we can give a round of applause to our special guests, Tony and Audrey, and our co-hosts, Joan, Jenny, Natasha, and myself. And on behalf of the PHA Club community, thank you very much for coming. And this talk was wonderful. Please make sure to join us for the next meeting, not next week, because next week's is staff development day, but the week after that, Tuesday at 11:30. Flyer to be sent out soon. Yes. So if there's no more questions, Joan, I guess you're the main host. You can choose to close this at any time you'd like.
I just want to say thank you so much, Tony. Thank you for reaching out to begin with. This all started with you reaching out. I think it was a great idea and really helpful. Glad we were able to record it. I know that it will benefit a lot of people.
Thank you so much. This was fun. Anytime.